Well, we're joined by Susan's daughters, Ruth and Sarah, from Manchester. And full disclosure, Ruth, you and I have worked together. We did a documentary in South Africa, and I know you well. And you just reached out to me because you've been following this whole debate about care homes, and you told me your story and how it impacted on your family. And I just really thought it was important, incredibly important, actually, to hear from people who've actually had to lose their loved ones in this situation. So tell us, Ruth, really, how you feel about what happened to your mother.
First, thanks for that tribute. That was lovely. I think that the hard thing is that when you lose somebody that you love, if you feel like there's nothing anybody could have done to prevent their death, then you can start the grieving process. But I think for both of us, that sense that we know that Mum wasn't close to death, she shouldn't have died now. She wasn't frail. She wasn't unwell. She was disabled, but she wasn't unwell, and she shouldn't have died. And there are things that the government should have done that they didn't do that could have prevented her contracting COVID. And I'm just at a loss to understand why they didn't have a plan. And I know that the home and a lot of the staff in the home felt themselves like they were the bottom of the pile. They weren't getting instructions. They were often having to ring Public Health England to get information about what they should be doing. And I think that's the hardest thing, is feeling angry.
Well, let's remind ourselves. Now you've mentioned the government. Let's just play. There's a series of clips here. I want to play Boris Johnson, the Prime Minister, who assured us that care homes had been locked down before the rest of us had been locked down, when in fact a Reuters investigation has now established that was a brazen lie, and that in fact care homes were the last places to be locked down. Let's watch this.
We brought the lockdown in care homes ahead of the general lockdown.
So right from the start, we've tried to throw a protective ring around our care homes. We set out our first advice in February, and as the virus grew, we strengthened it throughout. We've made sure that care homes have the resources they need to control the spread of infection.
People are only released from hospital if the clinical judgment is that it is better for them to be in a different setting. And the number of people who've been discharged from hospitals into care homes has been declining throughout this pandemic, and it's also 40% less than it was this time last year.
Now, the reality is, as the Reuters investigation has established, is that all of that was a lie. Pretty much everything you've just heard was a lie. And in particular, it was a lie that there were clinical reasons given for people being released back to care homes. There weren't. In fact, there was a direct order from the top of our public health officials to clear bed space in the NHS and to send thousands of people out of hospital to care homes. And we now know, because we've seen enough stories now coming out, that people were sent back with COVID-19 and they then spread the virus amongst other residents in the care homes and people died. And your mother was one of those people. So, Sarah, for you, when you hear government ministers and the Prime Minister basically saying, hey, we did everything we could have done, what's your reaction?
We're just so angry. We feel completely let down by the system. There was never any shielding in place for those care homes. They were the bottom of the pile from the beginning of this crisis. Nobody ever put any plans in place for the care homes. And we feel not only desperately sad for the loss of our mother, but we feel so angry that this wasn't her time. She should not have died. If the right shielding was in place, our mother would not have died from this virus.
Well, March the 13th, Public Health England issued guidance which said that visitors who are feeling unwell shouldn't visit care homes. So if you had symptoms, you should stay away, which makes perfect sense. But there was no ban imposed on visits. On the 23rd of March, the government issued a general lockdown. But it wasn't until April the 2nd that they issued a new advisory, according to the Reuters report, by the Department for Health and Social Care, saying visits should only be made in exceptional circumstances, such as when residents are dying. So when the Prime Minister says there was a lockdown before the rest of us, actually the truth is it came at least a week afterwards. And as a result, 22,000 people have died, more than the average in care homes.
And Ruth, the issue, of course, with your mum and the care home where she lived was that they received into the care home somebody who had this highly infectious disease. I mean, you must be beside yourself about that. If that person had been kept in hospital, things would have been different.
It's almost like, you know, you're sending a deadly virus into a place where vulnerable people live together, and it's like the perfect storm of, you know, words fail me that the instructions were to the hospital that the lady who lived alongside mum, who was diagnosed with COVID-19, was sent back to the home. I mean, and the fact that all through this, it's almost like whoever does the modelling and whoever comes up with the great plans that mean you can build a Nightingale clinic in 9 days hadn't thought about care homes. Nobody had thought about the most vulnerable people in society who live locked up together. And the other thing...
You live in a home together, so you're essentially putting that virus into that entire home.
And from a testing point of view as well, because the people who work in the care home weren't being tested, many of them were going off sick with symptoms, but that meant that you then had staff coming in from agencies who were then going to multiple care homes.
Yeah, I mean, I had two very good friends of mine who went through a very similar thing with their mothers. One's mother somehow came through when she was completely at death's door from COVID. Another, very sadly, lost her mother in her care home to COVID. So I've had personal experience now, 3 people that I know in this situation. And the saddest thing for my friend who lost her mother, who died, was that the last conversation she had was on FaceTime. She wasn't even allowed to go and see her mother as her mother died. And it just broke my heart. Now, you were both in a better position. You were able to see your mother at the end. How was that the case? And what was it like for you knowing that this had all happened and you had no control over it?
It was a week before that we got notice. It was 2.5 weeks prior to Mum's death that we got notice that she had COVID symptoms. But then she actually responded well to the antibiotics, and we thought she was actually going to pull through. And at that point, we weren't allowed to go and visit her. And then on the Tuesday before her death, on the Saturday, we got notice that she unfortunately was not going to get better. And at that point, we were allowed to then go into the home. And we know that we're some of the lucky ones, because I know early on that wasn't the instruction from government. You were not allowed to visit even if they were dying. So we know we were lucky to actually be with her.
And also, I think the geography of Mum's home made that possible, in that she was in a ground floor room. She had French doors outside, and then there was a side entrance. So we never actually had to go onto the unit. No. We literally just came from the car park where the nurses would meet us with PPE, and then we could go in and spend time with Mum without going onto the unit. And I also just want to say, we can't thank enough the staff who work in the care home, because they've been let down as badly as the people who live in them. And they worked so hard, and they loved Mum, and they were as heartbroken, you know, that she died in the way that she did.
You know, it's bad enough that your mother died in these circumstances, but when Matt Hancock has the brass neck to talk about putting a protective shield around care homes, when he only changed the advice to actually mandate negative tests before people went back to care homes on April the 15th, which we now believe was a week after the peak of this crisis and was nearly 2 months after the World Health Authority organisation called this a global health emergency, it's not just shameful, it is a scandal. And I think ultimately, when this all gets investigated, there are going to be some very serious repercussions. But listen, I'm so sorry to both of you for what happened. Just finally, before we let you go, just tell us about your mum. What kind of lady was your mum?
Oh, she was brave. She was beautiful. She was
graceful and elegant. And
she lit up any room. She really was, you know,
stubborn right to the end.
Yeah. She was, but she was the best mum.
And she was such a good grandmother to our children. And it's just, you know, it's utterly heartbreaking. This shouldn't have happened to her, and they need to hang their heads in shame.
You've done her proud, both of you, Ruth and Sarah. She was 68. She was no age. It shouldn't have happened. I'm so sorry.
You were robbed of years with your mother through negligence.
Yeah.
and it was deliberately done.
And all should have had, and that we should have had with her.
Yeah.
And watching the grandkids grow up, she's lost all of those years.